Welcome to Shaping Healthcare, a podcast by Citius Tech. Some of the great minds in the world are constantly striving to solve the healthcare industry's greatest challenges with technology, creativity, and agility. With every episode of the Shaping Healthcare podcast, we will take you deeper into the world of healthcare and life sciences and give you a perspective into what it takes to build a human-first, technologically enabled healthcare world. I'm your host, Laurel Rockall.
Joining us again is Ravinder Singh, Senior Vice President of Consulting at Citius Tech. With extensive experience in healthcare technology and digital transformation, Ravinder spearheads Citius Tech's strategic initiatives, leveraging emerging technologies to reshape healthcare delivery. His passion for innovation drives the integration of cutting-edge solutions that enhance patient care, operational efficiency, and industry collaboration. With decades at the forefront of healthcare innovation, Ravinder has witnessed the profound impact of digital advancements. Today, we explore his insights on the ongoing digital revolution in healthcare and how Citius Tech is leading transformative change to meet the evolving needs of healthcare organizations and improve outcomes across the board. Ravinder, welcome back to the podcast. It's great to see you again.
Thank you, Laurel. Pleasure to be here again.
As I just mentioned, you have extensive experience in watching digital transformation. You have had a front row seat, if you will, at watching this change happen over time. I would like to look at that big picture as our first talking point here. What have you seen are the key forces at play that are driving change in healthcare? And how do you see the future of healthcare over time?
Well, Laurel, very pertinent questions. First and foremost, the pace of change that we are seeing in healthcare, it's unprecedented. We never saw that. We always thought healthcare will remain the way it is. It will be slow in digital, but we have it. It looks like that things are changing way faster than that we expected, and multiple forces that are at play. The first and the foremost is the demographics itself, right? The kind of patient population that we are looking at, or rather, I would say consumer population rather than patient population. And it's not just the age mix. It's also the disease mix that is changing. So people are actually getting, diseases or morbidities earlier in life. Wellness is coming, as a part of the healthcare continuum. So if you really look at the definition of healthcare itself, the kind of demographics that we are dealing with, and the behavior of each of these demographics, that itself is driving the healthcare into a big transformation and, change itself. The second big factor, I would say, is the pace of technology. And again, when we say technology, the first bigger change is the healthcare technology itself. We are finding a lot more treatments which work in a different manner. For example, we see CAR T cells, which can cure cancer. We see radioligands. We see diagnostics changing. We recently saw 11.7 Tesla machines, which is creating such clear images of the brain. And now look at the kind of scientific innovation that it can create. The miniaturization of the devices themselves is leading to self-management. So there is a whole lot of innovation that is going on in healthcare itself. And the way, this can be delivered itself is changing the way healthcare would look like in the future. And then also the informatics, right? So this is all augmented by producing a lot of data that is now analyzable. So the informatics is also contributing to the pace of change. Then the third, which is a big area, all this is good, but unless there is somebody to pay for, all of this becomes on the paper. So the economics of healthcare is also changing. And, payers are becoming, a lot more relevant from being a part of the healthcare continuum rather than just, an organization which will just pay for the care itself. So essentially, if you really look at it, the technology, the demographics, the payments are coming together. And finally, the workforce. And this has been in talk, especially after COVID. I know it's been a while that we are out of COVID, but the challenges that were created as far as the workforce shortage is concerned, that will remain. It will take much, much longer time for us to recover. And the only way this can be done is by adoption of technology. So if I were to summarize, these are the four forces that are essentially driving this transformation across the board in the healthcare ecosystem. And again, when we look at healthcare, we have to look at it as an ecosystem rather than, individual organizations or individual segments of payers, providers, devices and life sciences, but an ecosystem that is now working together. So having said that, what does the future look like, right? So all these forces are kind of driving it into a particular direction. So what does the future look like? The first and the foremost is, I would say that our tiering will change. We had a very classic definition of our healthcare tiering, which is primary, secondary, tertiary care. I think we'll have to add a tier called digital. So it's digital or virtual, primary, secondary, and tertiary. That is the first part. And that comes with connectivity, that comes with diagnostic level data, which can be shared across the network. The second is we'll see a lot more active participation of patients, especially in the chronic care. So chronic care essentially is a very large part of the healthcare burden, and it needs to be continuously managed. So rather than being a hospital setting, it will be actually managed by the patients with the right intervention on a periodic basis by the physician. So that makes it, in a way, I would say, anytime, anywhere or boundaryless healthcare kind of a model. We'll see that for remote patient monitoring. And then finally, we'll also see right payment models emerging toward it. We had a very episodic way of payments. So will we actually look at care management? Will we actually look at wellness? Will we actually look at behavioral health? And that being actually paid for, because all of these are interconnected and essentially drive, the care continuum for the patient and wellness, and then essentially driving costs down. And then finally, coordinated. Patient journey today we know is broken. I know there are multiple factors. Regulators are actually pushing for it, which is exchange of data freely and with the right set of controls. But coordination across the value chain and creating a seamless patient journey when they're a part of, a healthcare consumer or they're consuming healthcare will also become an extremely important, part of the future journey of patients as well as providers and payers. So that's what I believe the future looks like. So it is self-managed, it is right payment models, it is, changes of the tier, which is boundaryless, and then finally coordinated journey for patients is what the future looks like.
Wow, that's a great answer. I mean, you had 4 big rapid changes and then a very hopeful and exciting future in how that ecosystem is going to look for healthcare. And these are big changes, they're rapid changes. What are some of the immediate and maybe medium-term priorities of these healthcare organizations amidst this rapidly evolving landscape?
Right. Now, thanks for asking that question. Now, if you really look at it, while we spoke about a very futuristic stuff, let's actually bring it down to, something which is very real on the ground. So the first and the foremost is, if any organization has to transform themselves, they have to find money. So the first short and medium term that any healthcare organization, and irrespective of the part of the value chain they are, is cost controls. How do I actually control costs? Because the way the healthcare system has built up over a period of time, it has actually become extremely expensive to find a drug, extremely expensive to deliver care, extremely expensive to, do wellness. If you really look at it, the whole cost in the system is extremely high. So every part of the ecosystem is not trying to control these costs, whether these are administrative, whether these are research, and whether these are care related. So how can I actually reduce that? And each organization is thinking about, how do I deploy technology to do it? How do I augment my processes? How do I even reinvent and reimagine these processes that I can actually be a lot more cost-effective and efficient organization? Makes sense, because unless I find money to invest, there is no way I can go for transformation. And transformation is now essentially survival rather than, another good thing to have. So once this is done, the second is they're also deploying, very heavy technology or digital-driven transformations in the organization, which is starting to think about, how do I adopt AI machine learning in the right manner? I know this is not an easy task, while AI does a lot of things, but actually making it production grade and making it ethical, making it accurate, and making it, I would say faultless or a flawless is extremely, extremely challenging, especially in the healthcare area. So how do I actually look at that and start bringing into my workflows? What are those steps? What's my maturity model for that? How do I operate ourselves, right? See, agile as a term has been associated with software development. It's no more software development. It's also the organizational behaviors. So we now start seeing organizations adopting agile, not just for the software pieces, but how do they operate as an organization in an agile manner, that they can actually reinvent themselves and continue to align to the priorities. And the third part of this is that they are starting to create new business models, which is starting to think about, see, one of the opportunities that digital brings is essentially taking the tribal knowledge and codifying it. So I can turn my tribal knowledge into codes. And that now becomes monetizable because first and foremost, it is no more lying on the desks and the heads of people who have worked there for years. It is now codified as knowledge into your machine learning models or in the data or in the insights that you have found. Now that becomes repeatable, that becomes monetizable. And that's a big area that we are seeing because now this is tribal knowledge. All of this is good news for patients because essentially, you were trapped at one place. Now this is kind of coming out and will actually become very, very beneficial to patients as these, knowledge bases start coming in a codified manner and deliver ultimate services to the patients. So we see, if you really look at, from different organizations, control the cost, invest into newer areas, become digital native, and codify my knowledge and deliver it as a service. These are the 4 areas where we see priorities of most of the healthcare organizations that we actually work with.
Yeah, it's change across the board and how, not only healthcare itself, but how these organizations are running. Thank you for laying that out so well. And how are organizations keeping pace with these sorts of shifts like this?
Well, again, let's take a look at it slightly differently, right? So if an organization was a human, it'll have a head and it'll have a heart. And I believe the same applies for any organization that works, that it has intelligence and it has feeling. And when you actually look at, how do these organizations start adopting something like this, they have to deal with both these, areas simultaneously. What does that mean, right? That means that they have to start thinking about newer models. They have to start ideating them early now. At the same time, they have to start driving these changes, not just from top down, but also at the ground level. That becomes an extremely, extremely important part for any organization. Now, if you really look at, these organizations as they think about these changes, they would actually need a partner who can actually bring in a very panoramic view of the industry. There's a vantage point that we have. So as an organization, if you really look at Citius Tech, we work across the ecosystem. We work with payers, we work with providers, we work with life sciences, we work with medtech. And while our clients have very deep knowledge in the work that they do, we actually are able to bring them, a view across the borders, if I may call, and help connect the dots that they have. That's a value proposition that we actually bring to the table as an organization who's deep into healthcare informatics and works with multiple customers. So you need a partner who can bring this kind of thinking and connect the dots. So that's the first part that we actually work with. So, and second is, as an organization, we are not just advisors or just thinkers, we are also doers. So that means when we work with our customers, we'll actually help them in terms of ideation, we'll actually help them with what should be done and elaboration of that, which becomes a very fair task. Business casing it so that you can actually, deliver value or articulate value. And then finally, actually deliver and measure the outcomes for them. It's kind of a full service organization. And that's what we actually bring to our customers as Citius Tech.
To be in the midst of all that digital change and to be that strategic partner for each of those points, absolutely a critical position, I think, for these healthcare organizations and leaders. So what does it mean for you all at Citius Tech to be that strategic partner to these organizations as they're going through this digital change?
So the first and the foremost is, how do we keep ourselves abreast of everything that goes on in the industry? So how do you create the thought leadership? So as an organization, we have to be a step ahead of our clients in our thinking. So that's, I would say, the first and the foremost. The second is, how do we continuously create this talent? It does not mean that we have only few people who can do this. We actually need to do it at scale. So how do we continuously create talent that can actually serve our customers? And then finally, how do we actually bring in, the accelerators? How do we actually bring in the real tools which can actually be leveraged by our customers to deliver on these? So we as an organization need to be not just somebody who advises and goes by, but also make sure that we kind of deliver to the whole value chain for these customers. So first and foremost, we have a very deep, learning organization. And we have actually taken this as a cultural aspect rather than an essential job that we have to do, which is making sure that we have created a culture of continuous learning. And that essentially means that, we can cross-pollinate all the learnings that we have in the organization. The second is the culture of innovation, which is continuously experimenting with new ideas. and experimenting with these ideas, not just in isolation, but with some of our leading customers. And as these ideas materialize, that actually starts creating a lot of knowledge, both for the organization and the customers, and some practical, kind of experience and expertise. And then finally, harvesting the knowledge of delivery that we have by customer. So making sure that, when our folks that are working on the customer, they become extremely intimate with their processes. And in many cases, they would know the processes even better than the customer sometimes, because they've been there, transitions, they've actually been working on day-to-day basis, making sure that they have a complete understanding. And finally, creating a culture of being proactive. So we are not just watching and doing it. We actually continue to, add value to customers by bringing in new ideas, saying, here is how you're actually doing it today. Here's the technology aspects that we bring in. Here is some of the ideas that we have. And a number of those ideas have converted into some transformative initiatives, as well as in some cases, delivered real value to customers. So as an organization, if I really summarize, how do we continuously create knowledge? How do we continuously create talent? And finally, deploy this talent in a manner that this is invasive and continues to add value on a continuous basis to the customer. That's a cultural aspect. So skill, people, culture is what we bring to the table and continue to reinvent ourselves.
Perfect. You certainly have a lot of experience and knowledge and passion about this area. And we've had such a great discussion today. As we wrap this up, what would your advice be to organizations as to, what are some of these key success factors for organizations as they undergo this transformative journey?
So again, I think transformation means many things to many customers. But, in my opinion, transformation is a continuous journey, whether you're trying to, again, go back to the traditional cost control, efficiencies, the so-called boring subjects that have been there around, or you're trying to create something new. It is a continuous change, right? So first and foremost is, whenever you look at something like this, the first part of this is think about the change. As I mentioned, the organization has a head and a heart. You have to touch the heart as well, which is what changed it. And make sure that, this change is well thought through. It's people, it is processes, and also your customers, right? Your customers also undergo change when you undergo change. And that means a lot, because it is make or break for businesses. It is make or break for even your customers. So think about change right from day one and not as an afterthought. That is, I would say, one of my key experiences that I would actually advise any customer who's taking on a transformation journey. The second is start small. Make sure that you have taken some baby steps into it and, proven the value. That means have done the business case. A lot of times we do take very bold decisions, but, the feasibility is where these things start to kind of elongate. So you might kind of create something which is not feasible within the timeline that you may have, right? So important that you take some baby steps before you scale and are fully ready with that particular transformative journey. Finally, while there is commitment from the top, you have to work on the ground as well. So it is both campaigns. You have to actually have a campaign making sure there's enough buy-in and there's a top-down commitment to an initiative. And the second is make sure that on the ground also we have created that buy-in and commitment. So you cannot just drive it top-down, you cannot just drive it bottom-up. It has to be a multimodal for any transformation journey and carry everybody along. Again, goes back to the change management. So these are, I would say, key factors. Now, whatever you are changing, it is totally dependent on what organization you're a part of, what exactly is your business strategy. But these fundamentals, in my opinion, remain kind of relevant across the board, across the timelines that I have actually seen in my last 26 years on any organization taking on a transformation journey.
I would agree. Absolutely. I think you've brought such wonderful insights and expertise to our conversation today. And thank you so much for joining me.
Thank you. Thank you so much.
The Shaping Healthcare podcast is brought to you by Citius Tech, a leader in healthcare consulting and IT services. To find out more about Citius Tech, visit citiustech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.